Good morning, everyone, and I would thank the organizers for the opportunity. Today I will be presenting two topics. One is yoga in breast cancer, and the other one is regarding the systematic review and mapping. So, this is our own TMH publication. For the first time, yoga in a randomized controlled trial. The role of yoga as a complementary therapy in women undergoing treatment for operable breast cancer. There were multiple small randomized control trials before. However, the primary endpoint for all these trials was quality of life. So this is the first randomized control trial where the primary endpoint is disease-free survival. So why CE is yoga with conventional exercise and CE is conventional exercise alone. So here they recruited operable breast cancer patients, and yoga and conventional exercise were continued during and after standard treatment, and the randomization was between yoga conventional exercise versus conventional exercise alone, and the primary endpoint was disease-free survival. Secondary endpoints were overall survival and quality of life. So for quality of life, they used multiple parameters with EORTC, brief fatigue inventory, visual pain scores, spiritual questionnaire, and so on. And this is how a brief fatigue inventory looks like, having multiple scores for each of the parameters. And the results were, it was a large trial with 850 patients with 426 and 424 in each arm. And if you look into the demographics, majority had smaller tumors with 3 centimeter. They were grade 3 in majority. They were hormone receptor positive in 70% and HER2 positive in 14%. So the disease-free survival was numerically better, however was not statistically significant with 80% versus 76.7%, and the overall survival was 85.4 versus 83.1%. The hazard ratio was 0.85 and 0.86, which was not statistically significant. So this is how the overall survival curve looks like. And however, what is important is the improvement in quality of life scores. The quality of life scores significantly improved in almost all the domains, including physical, emotional, fatigue, pain, appetite loss, arm symptoms, systemic therapy side effects, physical and emotional function, and fatigue score. So very important is if you look into the fatigue, which patients complain even at follow-up, this had completely resolved in the yoga with conventional exercise arm, which is important. And very relevant for me, which I found, was the post-operative area pain, for which the patient is really concerning. So this had shown a significant response. So the quality of life, the spiritual questionnaire had no difference, and the compliance was good enough in this trial, and the quality of life did improve from baseline. So the conclusion was there was a numerically better disease-free survival and overall survival, however not statistically significant. Yoga is a low-risk, low-cost therapy. It improves day-to-day activity, especially pain, fatigue, and quality of life. This is the first study where the long-term benefits in quality of life have been noted with the addition of yoga for women undergoing treatment for operable breast cancer. So this is a large randomized control trial, long follow-up, had addressed relevant endpoints including DFS, OS, and quality of life. And the cons are majority were early stage, and we need to see what is the what type of chemo did they receive, how many received taxane, what about locally advanced disease, what was the type of endocrine therapy used. All these also have to be looked at. So my take, so yoga and conventional exercise should be a standard of care because it's a low cost, low risk therapy, as it improves very important parameters of quality of life, especially fatigue and post-operative side pain. Then coming on to the second study, so it's basically a perspective of a psycho-oncologist and a cancer survivorship, mapping systematic reviews of breast cancer as to look into whether these systematic reviews are addressing relevant questions, and the other one, abstract, also has similar concept behind it. So we all know breast cancer is a disease where the cure rates have improved and breast cancer remains a history in majority of them, and there are a lot of long-term survivors, and if you just go and ask them, they have unique challenges. The unique challenges are the fear of relapse, second malignancy, psychological, social, occupational, financial, and chronic medical ailments. So whether are we addressing these parameters is what the systematic review mapping looked into. So breast cancer is the most researched domain with the largest number of publication than any other cancer. Lot of systematic reviews are existing, and this is the study where they used to map whether these systematic reviews have answered relevant questions that translate to clinical benefit. So literature review is just a summarization. Systematic review looks at a specific question in multiple trials, whereas meta-analysis looks at multiple systematic reviews. And a network meta-analysis is where they look whether the relevant questions are answered and is it relevant. So this review of systematic methodology used something called umbrella review methodology, and they reviewed reviews against matched domains, and network analysis looked at clustering. So they mainly looked into 3 domains: core domains, healthcare and delivery domains, healthcare outcomes. So these are the core domains: physical, psychosocial, chronic conditions, health promotion and recurrence and new cancers. And these are the healthcare delivery domains: clinical structure, communication, care coordination, patient caregiver experience. And these are the healthcare outcomes: quality of life, emergency services, cost and mortality. So what came out of this study was that these 3 components, physical, psychological and quality of life, were most studied, whereas chronic illness, employment, financial aspect were less studied. So there were 323 reviews they looked into, and physical effects, psychological and quality of life was most looked into in more than 50% to 70% patients, and majority looked into only 1 or 2 domains, and only 16% looked into 3 domains. And lately the reviews are addressing financial and chronic conditions. The chronic ailments, employment and financial is addressed in less number of reviews. So single problem, single symptom approach should not be the way to go. There's a low level of connectivity between domains and outcomes. It's a fairly superficial review of evidence in terms of strength and quality, and it does not align with holistic vision of survivorship care. So well, a lot of publications, many systematic reviews are there, but these reviews are focused on very few aspects, especially physical, quality of life and so on. So it is unevenly distributed. There are significant gaps in key domains and outcomes, and the assessment of evidence gaps in primary research and strategic planning of future research in consultation of survivors is needed. Thank you.